Looks like we do have a few people, but just checking. Do we have Gloria or Andrew on the call? Okay, maybe just a couple more minutes.
Okay.
I think we need 5 for quorum, but Anna, Paulina, our chief counsel's on the phone, so you can correct me if I'm wrong. And I think we have 4 right now.
That's correct.
Everybody's awfully quiet though. Does anybody have anything they want to chat about?
Can't believe it's already October. I'll put that up.
There you go.
All right, I think we have a quorum.
Excellent. So I will call the meeting to order. I'm just going to go over conference call etiquette. It is on the screen, but please mute your line if you are not speaking. Identify yourself and your organization before you speak, especially if you're making a motion. If you are on the phone and logged in over the web, please turn off your computer speaker so we don't get an echo. And the chat is reserved for council members. So welcome everybody. I know it's been a while since we gathered up. Glad to have you join us today. If I can go through the roll call, I know you've been checking names off, but just to make sure, Andrew Yang.
I am present.
Jolene.
I'm here.
Kenton.
Hey guys.
Robin.
Here.
Gloria. And do we have anybody from the Senate, President Pro Tempore, consumer representative?
No, that position has not been filled yet.
Okay, and we just still don't have one for Speaker of the House, consumer representative, correct?
Correct.
Okay. So moving along, I'm going to go to the meeting minutes. They were sent out with the meeting reminder. I hope everybody had a chance to read through them and review them. Do I have a motion to approve as true, the correct and accurate, the minutes recording the events, actions, and details of the November 15th, 2023 public meetings of the Pennsylvania Health Insurance Exchange Authority Advisory Council? Does anybody want to make a motion to accept them?
Jolene Calla from HAP. I'll make the motion.
And a second?
Robin Rothermel from PA Med, second.
Thank you. Any further discussion on the minutes or corrections? All in favor of approving the minutes as presented, please indicate by saying aye.
Aye.
Any opposed? The minutes are approved. This is the opportunity for public comment. Public participation is permitted at this meeting as required by the Sunshine Act in the absence of official policy relating to public comment at council meetings, and to ensure the orderly progress of today's meeting, all comments should be directed to the chairperson and should be limited to no more than 5 minutes in duration. Questions asked of the chairperson or the council as part of public comment may or may not be addressed at the meeting. Is there any public comment at this time? Okay, hearing none, I'm going to move on to welcome new members and turn it over to Devin.
You, Karen, and so happy we can all gather today about 30 days out from our 5th open enrollment period as Penny. And you may have noticed we have 2 new names on the advisory council. So I wanted to introduce our new members. The first is Andrew Yang, and he is from Community Legal Services. And the second is Kenton Porter, and he is the representative from the Broker Association in Pennsylvania, PA NABIP, which was formerly PAHU, which has a designated spot on the advisory council under Penny's statute. So I would like to just open it to Andrew and Kenton, if you each just want to do a brief introduction of yourselves. Andrew, let's start with you.
Hello, everyone. My name is Andrew Yang. I am a supervising attorney with Community Legal Services and a medical legal partnership attorney. I'm excited to be with you all and glad to be part of this process.
Hey everyone, what's up? I'm Kenton Porter. As you just heard, I'm the representative from PA NABIP. I have been in the health insurance industry for about 16 years. I worked at UPMC Health Plan for 13 and have been on the broker side for about 3 now. I work at a small independent agency, so that's kind of it.
Great. Well, welcome to Andrew and Kenton. We're really excited to have you as part of the advisory council. So today we have a couple of topics we wanted to walk through, and I would put them under the broad umbrella of affordability and awareness. As Penny continues to focus on how to increase access to affordable health coverage through Penny, we think the 2 main levers and the 2 main areas to focus on are affordability and how we can ensure that what we have to offer Pennsylvanians who are looking for coverage is something that they can afford and they see the value in. And then also awareness and really looking at how many people are aware of Penny and aware of the types of health plans that are available through Penny. So we're going to talk about a couple of topics today that really tie into those 2 overall themes. So the first is going to turn it over to Jennifer Lloyd, who's going to talk about our efforts around a very important affordability initiative related to the federal enhanced premium tax credits. Jennifer?
Thank you, Devin. Good morning, everyone. As Devin mentioned, my name is Jennifer Lloyd. I'm Special Advisor to our Executive Director, and we are going to dive in. So advance the slides. Tanya, are we able to go into present mode? As we're working on that. So diving into our enhanced premium tax credits initiative. So just a little bit of background, the Federal Inflation Reduction Act allowed for these premium tax credits to continue from the American Rescue Plan when they were originally enacted in 2021. They will expire at the end of 2025 if Congress does not act. And they are helping to make the premiums more affordable for Pennsylvanians. And so just a little bit of context around what we are receiving. We have over $500 million annually that are coming in related to these enhanced premium tax credits, and they will no longer be available if they do end up expiring. And this is about 1/5 of all the premium tax credits that are distributed to Pennsylvanians annually. It's going to pause a second.
I apologize. It is just not working. Give me 1 second.
Hey, it's Chachi. I have the deck. I'll be able to share
Yeah,
it.
I got it. Yep.
Okay, cool.
All right. So as I mentioned, these tax credits are over $500 million annually, 1/5 of all tax credits that we receive annually. Since the enhanced tax credits came into effect, we've seen a lot of enrollment gains, specifically with low income, pre-Medicare, young adult, and rural communities. So these populations we think would be disproportionately impacted if those tax credits expire and were no longer available. We looked at current enrollment and pricing, and if these tax credits were to expire, how we think premiums would be impacted. And what we were able to find is that premiums would increase by around 81% if the customer remained in their same plan and the tax credits expired. So pretty significant pricing changes if these enhanced premium tax credits are no longer available. And then finally, just the challenge that we're going to face around trying to communicate the expiring subsidies. 2/3 of our customers have only experienced enrollment with the tax credits in place because Penny launched going into plan year 2021, and then the American Rescue Plan allowed for these subsidies in 2021. So there was only just a couple months, a very short window of time, where we had customers that were still under the old subsidy structure. And so we think the communication around going back to that and what that could look like for customers is going to be very difficult, as many have never experienced that. We also tried to dive into a greater level of detail regarding the impact to specific populations. And so we first looked at the below 400% FPL, and this group of individuals was already receiving tax credits before the American Rescue Plan came into effect, but now they're receiving greater levels after ARP. And so what you can see here is that they make up 90% of enrollees that receive APTCs through the exchange, and they are going to see a pretty significant impact. So the graph here shows a per member per month net premium metrics and breaks out FPL by cohort. And so, as you can see, some cohorts around the 150 to 200% FPL range could see about 115% premium increase if the tax credits expire today. And then we have over here, the red is showing just isolating out the less than 400% FPL. They're going to experience on average a 76% increase. And then you see here the total enrollees, which adds back in the over 400% FPL, is where we get that 81% premium increase. So it's going to be felt broadly. It's going to be felt below 400% for low and middle income, and it's going to be felt above 400% as well. We also took a look at the specifically above 400% FPL. And for context, when we say 400% of the federal poverty level, for a family of two, that's about $82,000 a year. And for a family of four, that's $125,000 a year. So this population is about 10% of our customers using the subsidies, and they will see the largest cost increases, around $376 per enrollee per month. And that's about $1,500 for a family of four. We also see that within this population who's going to feel the larger cost increases, disproportionately, it's going to impact the Medicare population, or our 55 to 64-year-old age band, as they make up 58% of the customers that fall within this income band. And so just to give you a little bit of specifics and scenarios around what these customers could feel. When ARP was enacted, individuals over 400% of FPL can pay no more than 8.5% of their income towards coverage. And so you'll see the pretty significant impacts that has when that 8.5% cap is removed if we go back. And so under scenario one, we have a married couple, 60 years old, in Philadelphia, and they're at 405% FPL, so just barely over that 400% cliff. And currently, they are maxed out at 8.5% of income, so paying about $586 a month for coverage. But without the enhanced premium tax credits and that cap, their costs are going to increase to around 22.5% of their income, which is $1,500 a year or $1,500 a month. And so for them, they would experience around 164% increase in net premium if these subsidies are set to expire. And depending on where you live in the Commonwealth, that cost impact is even greater. So looking at the same couple in York County, again, currently they're maxed out at 8.5% of their income. They would be expected to pay 41% of their income, which is about $2,800 a month if the enhanced premium tax credits expire. And so they would be feeling around a 382% increase in their net premium. So we are obviously very concerned around the harmful impact that, again, all income ranges and different populations will feel if these tax credits are set to expire. And, we're trying to really pull the compelling data points together and educate around how harmful this would be, and lead to, some action at the congressional level. The final data cut that we took a look at was geographically the impacts across the Commonwealth. So we have a map listed out here, and it's showing the average annual loss of APTCs per policy if the tax credits were to expire. So now you're looking at that policy level and the dollars that counties can expect to lose on average. And so we have the county map here. We also listed out or indicated rural counties versus urban counties based on the Center for Rural Pennsylvania's definition. And what you can see here is that the kind of central corridor of Pennsylvania stands to lose the most dollars if these premium tax credits expire. And these counties are more rural than urban. And so although every county would be losing APTCs for policies within that county, we do expect that predominantly rural counties would feel a larger impact because they would stand to lose more dollars. Are there any questions on these deeper data cuts that we went through to try to show the impact of these enhanced tax credits being left to expire at the end of 2025?
Are we, is Penny going to be doing anything to like rally behind this in order to see if we can get it to continue past the end of 2025?
Yes, so that leads us then into our last slide, which is we've worked to quantify the effect. This is, sorry, one more slide around quantifying the harmful impact. And it's just talking about the buying power that would be lost if these tax credits were to expire. So we've seen a lot of shifts up to gold plans, that enrollment in gold has increased by 17 percentage points since our first OE. And we've also seen more affordability, obviously, with more dollars coming in. So the number of enrollees since 2021 with monthly premiums under $10 a month has doubled. So again, as I mentioned, like quantifying the issue, it's going to be a large impact. We've seen a lot of positive gains in enrollment and affordability due to these enhanced premium tax credits. And so we want to educate on that, as well as start to talk about what we can do to prevent this from happening. And some of the ways that Penny is looking at preparing, we're pulling together customer testimonials around how impactful these subsidies have been for families and individuals, working with our sister partners and other stakeholder groups to pull those in make them very compelling. We're even looking at possibly putting them into different formats than just written narratives. So maybe doing some videos and showing them from different geographic standpoints across the Commonwealth. We are also, again, looking at the financial impact, trying to look at some compelling data points and really get this data out there to educate, so other stakeholders can leverage this data in their talking points and any type of advocacy work they're doing. We really feel that, you know, our role is educator, because we do have impact. We have access to this data. And then finally, just as a bit of an update, we did send a letter to our federal delegation earlier in September to urge making permanent these subsidies. And we included some of the customer testimonials and some of this data as well. And so, you know, we have kind of sent up that communication to federal delegation. And we're also starting to talk about internally pulling maybe some district level data that we could use in some one-on-one communications. So that's a little bit around what Penny's doing. Would love to, you know, kind of open the floor to hear what your organizations are thinking about or talking related to this topic, and how we could partner with Penny to again advance education and action on this, because we think it's, you know, one of the largest threats to our customer going into next year.
I'm going to jump in really quick and say that we are happy to do some outreach to our legislators as well. But also, I mean, you showed some examples of how premiums may change. How many people do you expect might drop out of having coverage because it's no longer affordable?
So that is analysis we have not yet completed, but we are starting to work towards that modeling, because, you know, there would be a lot of impacts around that type of disenrollment. So we don't have a specific figure right now, but we are looking to actually model that out and see how it would impact.
And one thing I'll add there is that we do know we've seen over a 30% increase in enrollment since these tax credits went into place. So, you know, we think that the impact could be that large or larger just because of how many people have enrolled. As Jennifer mentioned, the only experience they've known has been with this additional affordability. So we are modeling to try to get to a better range or estimate, but just to put it on the scale of what we've seen since they were in place, we have seen significant enrollment since then, and we think a lot of that could be reversed without the continued affordability.
Hey, it's Chachi. I just wanted to add another thing to that, if I could, that we've also seen a lot of folks buying up from bronze into a richer silver and gold plan. So, you know, when we're looking at that modeling, I think that we're really focusing too on, it's not just disenrollment, those that would leave, but also potentially buy down to having a lesser quality plan.
And Karen, appreciate the call out on helping with outreach. That would be really great. Any others thoughts on either data or educational outreach, things like that?
This is Jolene Calla from HAP, and I think we can certainly help with the messaging on this. I think it fits particularly well with one of our priorities, which is preserving care in rural communities. And I can tell you, I'm definitely going to use these stats and slides to educate both our policy team and as we talk in various different settings with our hospitals. So happy to pass this deck on. Any other stats like this are particularly helpful. And if you get those video testimonials, those have proven very effective in other settings. So I'd be very anxious to get those as soon as they're available.
And I think one question, Jillian, from the hospital perspective, if one area that we think could be helpful, but we don't have a lot of insight into, is the implications on the provider side. And maybe this is a comment for a few of you. the higher the uninsured rate, what is that impact on the provider side if more people lose coverage? I think if there's any data or insights that you all have from that perspective, that could be another component to work in here about how the more people who are insured, that has downstream effects on providers and, and access to care, but also in reimbursements and things like that. So if there's any information or data that you think could be helpful from that perspective, we would certainly welcome it as well.
Let me go back and think about that, because there are definitely some things. However, as you know, it's like a balloon when you look at that, because when your less insured or uncompensated care goes up, there is a mechanism to account for that. So we would have to balance, how that all works out. But let me go back and think about that, and then I can circle back.
I think the other thing that we can do is reach out to some of our community nonprofits and community healthcare providers and give them information that they too can also rally behind. Are you able to put together, like, I know that these slides say proprietary and confidential, or is it possible to get a few documents that we can put in a package with a sample letter to do that grassroots outreach and say, here's what you can do?
Yes, we are very excited to partner, and whatever collateral we can produce to kind of assist you all with communications or outreach, very open to doing that. And I think we will be posting these slides on our website. So when they do go public, these are also available for you all and your stakeholder groups to access. Are there any other questions or thoughts around partnership in this space?
Again, another thing I'm thinking of is what outreach has been done to the major healthcare providers that would then have to carry a greater burden because they might have people with lesser insurance or no insurance coming in to try to get treatment. Are they being rallied at all?
I don't know, Devin, if you want to speak to who we've engaged so far.
Yeah, I think that is part of our approach of trying to reach out here, and then we do want to continue to reach out to others to see what other data can be brought in of, or even data around are people delaying care until the conditions are much worse when they don't have coverage versus when they do. So I think really trying to look at it holistically and draw in a lot of those downstream impacts from on the consumer side, on the provider side. We do know that a lot of insurers are very focused on this. I think the good news is that there's a lot of alignment around wanting to keep people who have coverage insured across all the different stakeholders, both, we've seen it at the national level and hopefully the state level too, sort of having that alignment on wanting to keep this affordability for people. And I think it's a matter of trying to get the data, for us, but also out to people in their hands to use in those conversations, to feed up at different levels from between state and national organizations. Does that answer your question?
Okay, I will move us then to our next section, which is with Devin, and it's our state subsidy program.
Great. So in the same vein on affordability, what we have seen overall from the enhanced premium tax credits is that affordability matters. When you make something more affordable, people do enroll, and it does sort of put that in reach. As we'll talk through, even with those enhanced tax credits, we still see cost barriers. So we're going to talk a little bit about some efforts over the past few months to address that at a state level. So the overall premise is that, individuals and our whole healthcare system benefit economically when the insured rate is higher. Currently, Pennsylvania is at about 5.6% of the population that is uninsured. And this could potentially be higher as the data catches up with the unwinding. I think we don't have, the latest data we have is from 2023. So people who may have no longer be covered through Medicaid, that number could could potentially, we could see increases when we look at 2024 data when that comes in. So as I mentioned, that we really see our two approaches are awareness and affordability, and that they're really tied together. On the next slide. We do continue, as I mentioned, to see cost being consistently named as a barrier to enrolling and maintaining coverage. Our counterparts or our the Pennsylvania Health Access Network did a really great study of Pennsylvanians who were uninsured or who had coverage through Penny, and found some really compelling statistics about the impact of the cost issue for people. So 4 in 10 who are eligible did not purchase due to cost or had coverage and dropped it due to cost. And 6 in 10 felt that plans through Penny are barely affordable or unaffordable. And this applies to both the prior topic and this one. With unaffordable options, individuals either go insured and put themselves at significant financial risk in the case of illness or injury, or perhaps go enroll in unregulated plans off Penny that may have lower monthly costs, but often exclude important medical care, potentially have limitations on pre-existing conditions and exclusions of that care, and can impose lifetime and annual limits. All of these practices are prohibited under plans that are available through Penny. So, we do often hear from people who come in and say, I thought I had a full plan. I bought it, outside of Penny. And when I actually got sick, it didn't cover anything. And, it's unfortunate to hear the stories of people who are in that situation. And then another impact, of course, is that people potentially forego critical care if they do not have insurance and don't have that, key to the healthcare system. So on the next slide, so we, as a state-based marketplace, one of the things we can do that a lot of other state-based marketplaces do is have a state-level affordability program. That is something that when Pennsylvania was accessing the marketplace through healthcare.gov, that type of flexibility was not there. So it's one of the most unique and valuable things we can do as a state-based marketplace is to find ways to increase affordability. So we looked at what it could look like to have a state-level subsidy. So we looked at, again, the cost impacts and what types of costs and what types of reductions of those could be beneficial, and found that if we could further reduce premiums, it could both impact the premium coverage and also it could serve as an indirect out-of-pocket cost reduction. And we have seen that through ARPA as well, where sometimes people will choose to continue paying the same premium amount, but they're able to buy up to another level of coverage with that same amount, allowing themselves to get more value out of that coverage and reduce those deductibles and other out-of-pocket costs. So we had a lot of discussions last year with some of our colleagues in the insurance department about the interaction with the reinsurance program, but then really had a lot of discussions with the state legislature as well about what it could look like and the benefits that could happen of having a state subsidy. And we, on the next slide, we're excited to see that some of that discussion did bear fruit on the legislature side. We had a lot of support, we felt, through those discussions, and a lot of what we talked about with them was that a state subsidy through Penny would increase economic and financial security for individuals across Pennsylvania, increase health outcomes by allowing better, more consistent access to medical care, benefit through providers through more timely and consistent reimbursements, benefit insurers through stronger retention and increased covered population, and strengthen individual health insurance market by improving the risk pool. So we proposed a model that would allow a state subsidy to further reduce the cost of health coverage for enrollees, to reduce those cost barriers and help increase the insured rate. Also allow current enrollees to buy into higher value plans with less cost sharing to reduce the out-of-pocket cost barriers, and improve the ability of current enrollees to keep that coverage, especially some of the 6 in 10 who are enrolled but find that coverage on the cusp of unaffordability. So, one financial change away from not being able to afford health coverage. And also, again, with having access to coverage through Penny, improving the access to free preventive care to catch issues early, while also being able to treat ongoing chronic conditions. So we were pleased to make progress with the legislature on this topic, and in the budget in July, they did include the framework of a state subsidy. I'll note right off the top, it is not yet funded, so we are, I would say, halfway there. So they wrote into the budget process, through that process, they wrote into code the construct of a state subsidy program. So the fiscal code was amended to allow for the creation of a state health insurance exchange affordability program beginning as early as 2025, but again, contingent on funding being provided through the General Assembly. And the idea would be, and the purpose would be, to incentivize enrollment by providing additional financial assistance to individuals purchasing coverage through Penny. And it would be focused on the population below 300% of the federal poverty level. And as part of our analysis, we really found a lot of ability to be able to buy up if the state subsidy did not apply to bronze plans. Bronze plans are already frequently available at no cost to consumers, and a lot of the barriers there are related to high deductibles and high out-of-pocket costs. So in looking at the different options for how to make a relatively modest state subsidy go as far as possible, we really focused on that buy-up power for current enrollees and reducing costs for potential new enrollees. So the legislation did outline those criteria for a program. It also allows for 2 funding mechanisms for this program: a disbursement from the Joint Underwriters Association to not exceed $50 million annually, or an appropriation from the General Assembly. The Joint Underwriters Association funding is not currently available. There are certain things that would need to happen with that in order for that money to be available. So that is not a guaranteed source of funding, and the other option would be the General Assembly. So wanted to provide this update that we do have the construct of a state subsidy program kind of written into the code at this point. And the next step that we see is really focusing on how to get that funding for the program moving forward. What we saw from the type of construct that we could have for a $50 million program between 150 and 300% of the FPL is that everyone below 200% FPL would be able to have access to a free silver level plan. And it would increase, many times doubling, the access to silver and gold level plans at $0 premiums for people up to 250% of the federal poverty level as well. So that access to lower premium plans, a lot of our uninsured continue to be on those lower income scales. So we think it could really have a very positive impact on, again, current enrollees who are stretching on the premiums, and especially the out-of-pocket costs, allow them to get lower out-of-pocket costs, more value for their dollars. And on the side of people who are uninsured, because that initial premium cost is still out of reach, we think this would allow more people to be able to access health insurance and progress and further the goal of trying to reduce the uninsured rate. So we wanted to share this update. This is another area where, we see in the future ongoing discussions with the state legislature on the funding mechanism and how we could bring this program fully to life with that funding in place. So, if any one wants to talk more about that and that strategy there, open to conversations on that as well, but also wanted to share this update and see if there are any thoughts or reactions or sort of any further ideas about, again, sort of that similar on the ARPA and the enhanced subsidies, sort of any additional information that or ideas you all have about really helping bring home the value of what we could do with a state subsidy. Thoughts or feedback?
So is there a plan to start talking about how to get this funded? Because I know in the state budget process, all the agencies are working on their stuff starting, really now, October, November, and, then getting it vetted through December, January to come out in the proposed budget, which is February. So it seems like that work should be underway. And I'm just wondering, is Penny working on that with someone? Are you, because it seems to me, I mean, we can talk about the best program in the world, but if it can't get funded and implemented, we're just talking, right? So is there a formal plan there, I guess is the question.
Yeah, I think we see a few different paths. Certainly there is the path you mentioned, and then I think, also continuing discussions on potential funding mechanisms directly with the legislature as well. So I think we are, wanting to take a multi-prong approach of continuing to talk about the benefits of the program. There was an effort taken to actually write it into the code with, specifics around what it would look like. So, I think writing that in and then really completing that commitment to that program through funding is really what we are working towards. That is, of course, always the hardest part and also the most important part for any program. So I think we are interested in taking sort of a multi-prong approach of trying to just continue to keep it top of mind and, create the windows for opportunities for funding and really try to identify some options there. So we are, definitely interested. I think if there are other organizations that also are aligned with wanting to make this a priority, I think that's also what we're looking, to have discussions on at the state level as well. So certainly we are open to that in addition. And so this is when I think if you have thoughts now, or if, it's something to think about offline and want to connect with us directly too, I think we're, again, really looking for, we think that the more sort of awareness there is of this potential program and the potential benefits and, the more support there is sort of broadly for it, we think would be helpful. Okay. So there isn't if there aren't any other questions or comments there, you may hear from us more directly on some follow-up on that topic, but just wanted to walk through kind of where we were at this point. Meanwhile, we've also been doing some deeper looking into trying to understand the uninsured across Pennsylvania. So we're going to talk through some of our very interesting findings on that as well. So I'm going to turn it over to Chachi.
Thanks, Devin, and still good morning to the council members. For the new members, my name is Chachi Angelo. I'm the Director of External Affairs. So I oversee kind of the two departments in Penny, which is the Marcom side, which is website and social and customer emails and text messages, press releases, all of that stuff. And then on the other side is outreach, which is overseeing our contract for our sister network, but also our grassroots, shaking hands, kissing babies, setting up the tent, making sure we're doing all the outreach and, really connecting with the community side. So kind of overseeing both of those departments and, looking back a little bit, we've always been kind of reactionary at Penny of we need to react to this policy thing or this pandemic thing, or we're very reactionary. So we're constantly trying to create creative in reaction to, but at least this year we felt that, after the Medicaid redetermination, we were able to kind of go, all right, we've gotten a significant amount of Pennsylvanians enrolled through Penny. Obviously, we want to keep them with different cost measures and different advocacy that we're doing that we mentioned earlier in the presentation, but also get a better understanding of who's left. So we really dove into a full market research that has multiple steps to it. And I'm just going to walk through the 2 steps and potentially speak a little bit to the 3rd step that we just completed last week, and then what's to come next so that we have a better idea of the high hanging fruit left of the uninsured that we still need to reach. So the first step was more of a digital survey. It was with 600 uninsured Pennsylvanians, various demos and age demographics, ethnicities, race, occupation, different demos throughout. And what we took away was some surprising and then some like just kind of confirming what we already know. Cost, most common barrier across all demographics. The uninsured, at least in this survey, rarely think about health coverage, but they understand the financial risks that come with it. Of those out-of-pocket costs or if, potentially an illness or injury. Awareness of Penny is still very low. Amongst the uninsured here, only 30% knew what Penny was. The process is still confusing and overwhelming, and the terms are hard to understand. And also, too, there was a real disconnect between like them knowing about Penny and then what they want. They want to have something that gives them free preventative services. They want to have somebody that walks them through the process and does and really holds their hand as they go through. So really, few were aware that, we offer even the tax credits, the financial savings, and even the free services of the assisters and brokers that's at no cost to the customer to really get them from point A to covered. And this is really summed up in this report that's linked here. And then we'll be consistently kind of adding to that report with each step. So we'll jump to the next slide. The second step in this market research was message testing. Again, 500 uninsured, various demos. We were trying to look at things of like what resonates, message-wise, tonally, what resonates. Also, what's their media consumption? So humorous, educational, right at the top amongst all demos, especially in insurance-related ads. And I think that kind of goes along with like the Geicos and the Progressives, having more, humorous ads. But we learned a little twist in that as we got to more of the in-person focus groups, which I thought was interesting. And I can get to that near the end. And then where are they receiving their news? Primarily social media, some online sources. So really digital heavy, some top streaming services, top audio services there. And there was some skepticism whenever it came to trusting social media channels, and where the universally trusted sources were is pretty much what we would all expect. Friends, family, certainly those folks that you lean on whenever you're looking for valued information, and the local hospital in one's community. So jumping into the next slide, I'm going a little further into that message testing, and we ranked kind of like 4 different messages in there of helps pay for a wide range of care. A lot of the demos were listing that as crucial or important, cannot be denied for pre-existing conditions. Just a call out that the gig workers really considered this crucial. Gig workers, for that you're not sure of, are those that are primarily don't work a regular 8 to 5. Think of an Uber driver or a delivery for DoorDash or an independent contractor, that sort of thing. Financial protection if they're sick or injured, listed as just important for most groups, and then free preventative wellness screenings listed as important or nice to have by most groups. And then just to note that most Spanish-speaking audiences really rated all of those messages as nice to have rather than important or crucial. So all of this really just kind of goes to the back of our mind whenever we're creating creative messages or talking points for our stakeholders of what is going to most resonate with the uninsured and in specific media channels. So what's going to work on social, what's going to work for in person, what's going to work on TV for a broader audience is really where we're trying to figure out that right line to toe. And going into the next slide, this is more of the message testing again of, the awareness of Penny. So globally across all of the demos, that the awareness still sits at 30%, but amongst Hispanic and Latino drops all the way down to 17%. And then for gig workers bumps up to 46% because they're most likely not receiving coverage from an employer. So they're, maybe their antenna is a little up for where do I access coverage. So that was an interesting disparity and encouraging, at least, too, from the gig workers. The one thing that we notice is the more folks that are aware of Penny, the more likely they are to recommend Penny to others. So just getting into the funnel, just a search, a visit to penny.com, understanding just a little bit of how this all works is, at least in our survey and what we're kind of deducing from it, is that puts it in the back of their mind of, oh, I know somebody that this is good for. Or if somebody says, oh, I lost my job, I don't know where to go for coverage, they're more likely to go, oh yeah, I checked out this Penny thing. And then once we explained what Penny was at near the end of this this message testing, more of those audiences leaned toward, oh, this is probably right for me. And that was even higher amongst African Americans. So how does, before I kind of jump into like the next steps and what's kind of coming down the pike, and we can jump to that slide if you want, Jennifer. How does this resonate with your daily work? Does this seem to go, yep, that checks? Or it's like, no, that's not what I'm seeing. So just with you looking at your daily work and how it's affecting and working toward our common goals, does that match up? I want to see your reactions to that.
I was a little surprised at the financial protection is just showing as important and not crucial, just because all of the attention that we've seen nationally and in the state on medical debt and how much people are suffering, across not just uninsured, but just in general. So that surprised me a little bit, but everything else kind of tracks, I think.
That's cool. Thank you. Yeah, it also, I feel like sometimes we are in our bubble and we think we kind of know what folks are thinking about, but I know we had 2 in-person focus groups last week. Now these are folks that live in Philadelphia, so not a necessarily statewide look at what all Pennsylvanians or all uninsured Pennsylvanians are thinking across the state. But it was really a great look at how folks really want health insurance, but when it comes to their education level, their socioeconomic status, their occupation, there is still a lot of confusion around where do I go, where do I start, who do I call, who am I asking for information? And the one thing that jumped out to me was one lady was talking about being a gig worker, and she said, I know that I need insurance. It feels unaffordable to me. And I think about being uninsured consistently throughout the week, whether that's 2-3 times a week. And she goes, I'm really stressed about it. And I worry about what that stress is doing to my health, that it's almost compounding on itself, or a self-fulfilling prophecy. But there was a lot of great insights there from the focus group too. So kind of next steps from this market research is taking our lessons from the in-person focus group, continue that message testing throughout open enrollment. So what we can easily change, like a social media ad, and seeing how those messages are resonating and getting the most clicks. So it's going to further help our message testing. And then from there, really kind of building out personas. So Lisa lives in York County, is a gig worker, maybe has 1 or 2 dependents, is high school educated, thinks about this, is on social media, really building out personas of the uninsured, so that when we're creating the creative and the messaging, that we know explicitly who we're targeting, having a better understanding of customer mapping of where they start and how they end up at Penny, more creative testing, and then launching a fresh new campaign in the next year, really targeted toward our identified persona. So this is really kind of an ongoing process that we can continue to test as we go through open enrollment.
I think it's interesting that they get most of their news from social media and online sources, but they are very skeptical of trusting social media channels.
Yeah, that's interesting. Something to balance whenever we're creating the messaging that we know will be on digital. How about the new members? How does this resonate with you two?
Hey, this is Kenton from NABIP. The awareness of Penny was interesting to me because it like kind of fell in line with exactly what I thought. Like gig workers, 46% of them being aware of what Penny is, like that's right in line with what I thought. The total surveyed 30% being aware, I don't know. I know what it is, obviously, because I do this for a living, but like I still think that's pretty low, right?
Oh, yeah, 100%. Yeah, I'm not,
Okay.
not tickled with that number whatsoever, but it is good to know at baseline where we're at and
Yeah,
from which we
I
can
mean,
grow.
you gotta have a starting point, right, to build on. So yeah, I think more as obviously time moves forward, more people are aware of what it is, but I think how do I get there is like that's the trick, right? Like they know what it is, but how do I do it? You know?
Mhm. Yep.
So
Yeah, thanks, Kenton. Appreciate that.
This is Andrew Yang from Community Legal Services. Personally, yeah, a lot of the data matches up with my experience with clients. A lot of times, the people that we're working with or that I'm working with are people that I'm pointing them to Penny because because they're ineligible for regular Medicaid. I would say a lot of times, specifically for people who can't get Medicaid and Penny is their only option, their difficulty with Penny is that, well, they might not know it exists, but also they're not sure how to navigate it, either because of language barriers or because the process is kind of confusing to them, especially if they're dealing with different immigration issues. But I think in general, a lot of this lines up with what I'm seeing.
Yeah, thanks for that insight. And I'll just briefly say to Kenton's point, you just in a customer's purchasing decisions, you don't necessarily know about something until you need it, or your antenna isn't up for something until you need it. If you need new tires for your car, you're normally like your antenna is up. You start seeing advertisements or you start seeing places that sell tires. And that's kind of the same way it goes for health coverage. Is if it's not top of mind, if you're not thinking about it, you don't know necessarily where to go or see those messages or advertisements out there. Our goal is that when they need it, they think of Penny.
One thing I thought was really good last open enrollment, you guys actually had some TV spots on, and I thought that I took notice of them just in my own personal life, so I was hoping others did, but it sounds like based on your research, maybe some of that gets retargeted to digital ads, right? And to going more where they're telling us they are, I guess. So I'm sure you guys are thinking about that for going forward, but yeah, I thought those ads were really good last time.
Great. Yeah, thank you for saying that. We're going to reuse those ads for this open enrollment, and we're just slightly shifting them in a digital sense to kind of continue to message test. So you know, that the person that's kind of calling on the phone, you don't necessarily see them, but they're going, hey, can I get somebody to help me walk me through this? You know, as a way to test of like, oh, we're seeing that they want free help. Let's see if we can at least show them that that's, you know, one thing that you can find here.
Okay, well, thank you all for the great feedback and great discussion. So we're at time, so we'll go ahead and wrap this up here. You know, we are really excited for this open enrollment. We had record enrollment coming out of last year, and we've been able to maintain a lot of that because of the increased enrollments coming over from Medicaid that have continued even after the unwinding has closed. It's sort of regular course of business. So we're really excited to build on that in this upcoming open enrollment. If you have thoughts or ideas in between meetings, please do feel free to reach out. We will be looking at trying to schedule the meetings more consistently. So, you know, maybe like a September, March type schedule where it's predictable when the meeting's going to be each time. So you will get also some outreach on looking to kind of cement some of those in with more predictability for the meetings moving forward. We really appreciated everyone's time today.
Thank you.
Thank you all. I think at
Thank
this
you.
time, all of the agenda items have been covered. Andrew and Kenton, I hope you enjoyed your first meeting. We look forward to having you come back again. And there's really important things that we talk about here. So I love the idea of bringing it back to a more regular schedule. So at this time, if there's no further discussion, I'm looking for a recommendation to adjourn the meeting of the Pennsylvania Health Insurance Exchange Authority Advisory Council.
It's Gloria Velasquez, I motion.
Thank you. And I think we only need one, so you don't need a second on that, right?
You only need one.
On an adjournment. All right, so that's all. Have a great afternoon, and hopefully we'll see you all in a few months.
Thanks, guys.
Thank
you.
you.
Thank you.
Bye.